Okay guys, in this video we'll be talking about the blood supply to the kidney. Out of the entire cardiac output, 20 to 25% of the cardiac output is being sent to the kidney. So in that way, 1 liter of the blood will be present in the kidney every minute, will be circulating in the kidney in every minute. And now, what is draining from the kidney? Renal vein drains from the kidney and finally drains into inferior vena cava. That will be draining into the right atrium. Okay, this is the blood supply for the kidney. Now let us see about this renal artery. So renal artery is a main source of blood supply to the kidney. Renal artery. So if this is the aorta, it will be giving a renal artery, it will be giving. So when you see this right renal artery is a bit longer than the left renal artery, because actually this aorta is present a little bit left. So the right one has to be a bit longer. So the right renal artery is a bit longer when compared to the left renal artery. And this right renal artery is longer and passes posterior to the inferior vena cava. Passes posterior to the inferior vena cava. So now this is the aorta. So this is the renal artery. So just for the sake of understanding, I have made very long length. So at the hilum, this at the hilum point, it will be dividing into the anterior and the posterior division. It will be dividing into two trunks at the level of the hilum. This anterior one will be further dividing into the 4 segmental arteries. The 4 segmental arteries, namely the apical, anterior superior, anterior inferior, and the lower or the basal segmental artery. Whereas the posterior division will continue as the posterior segment. Okay, so try to see this. So this is a kidney. There are some segments in the kidney. This is the apical segment, anterior superior segment, anterior inferior segment, and this is a basal segment. So arteries supplying them will be given the respected names. This is the apical segmental artery, anterior superior segmental artery, anterior inferior segmental artery, and the lower or the basal segmental artery. And whereas the posterior trunk will be continuing as the posterior segmental artery. Okay. Now, after dividing into these segmental arteries, now what happened? After dividing into these segmental arteries, they'll be dividing into interlobar arteries. Interlobar arteries. Actually, this is completely a renal lobe. A renal lobe includes a pyramid, adjacent renal columns, and the cortex overlying. So hence, these are called the interlobar arteries. These interlobar arteries further give the arcuate arteries. These are the arcuate arteries. These arcuate arteries will be given interlobular arteries. Interlobular arteries. Okay, this is all about the division of the renal artery. After this interlobular artery also, there is some further division. Namely, so this is anterior division, segmental artery, interlobar, arcuate, interlobular. Okay, after interlobular, it becomes afferent arteriole, glomerulus, efferent arteriole, peritubular capillaries, and finally forms the vasa recta. Okay, this is the complete division of the renal artery. Okay. Okay guys, this is all about the blood supply to the kidney. Thank you for watching.